Once the tumor is excised, the tumor bed can easily be marked with a VeraForm. As the marker will come with some packaging memory, simply straighten it between your thumb and forefinger and place a simple knot at the end of the marker and trim as appropriate. The helical pattern is one of the quickest and most popular placements. This is particularly useful in simple lumpectomies with minimal tissue advancement. Starting at the deepest point in the lumpectomy cavity and working in a circular fashion, advancing the suture upward toward the anterior-most aspect of the lumpectomy cavity, the marker is placed in a helical fashion. Once the anterior aspect of the cavity is reached, tie a knot, keeping the entire marker tension-free, and divide the marker close to the knot. However, if you prefer and are planning on advancing tissue, you can place rectangles as shown. First, two box-like rectangles are placed at either end of the lumpectomy. This is quick and easy and works very well for small lumpectomies with limited tissue mobilization. Here we see an L-shaped placement, which I quite like. In the diagram, the L shape is placed into the lumpectomy cavity such that one L touches the posterior all the way to the anterior margin along the lateral and inferior edges. The second arm of the L touches again the posterior to anterior margins along the medial and superior margins. A very similar technique is to place the marker in a U shape. If only the anterior margin will be significantly mobilized, an upright U-shape placement with a separate single box along the anterior margin is very effective. A square placed in the anterior-most aspect and one in the posterior-most aspect of the lumpectomy cavity can be very effective. This allows for marking of any additional margins as appropriate to the planned surgical approach. Once the lumpectomy has been marked with a VeraForm, you simply close the breast in the usual fashion, reapproximating tissues as appropriate.